Cholera is raise awareness quickly, IV fluids, because cholera is a disease of losing water from the body fast, and either through vomiting or through diarrhea, stool. And once we can get our patients quickly to the hospital, to the health centers, then the healthcare provider should be available to started. I'm not going to be a prophet of doom. This might, if we don't curtail it quickly, it might run out of hand because of the added, bashing from the economy. But by and large, as I've said from the beginning, it's a disease of the environment, how clean the environment is, because it is transmitted from it's a fecal-oral transmittable diseases. That means whatever goes to the mouth that is infected and it is infect the system. Of course, we pass the germ or the bacteria through the stool, and of course, if it contaminates the next person or the next food items available, we will get it. It's a cycle that keeps on, revolving. So I think basic hygienic, principles must be, taught to our people. They must abide by principle of washing hands constantly. There should be water everywhere to wash hands and to prepare our food ingredient, tomato especially, that rottens easily. We don't have preservatives, and somewhere somebody is telling us we can't preserve tomato for more than three days in our freezers. I mean, those are mere speculations. We must be able to take good care of our.
Why is the same kind of message not related to, the cholera situation? Because cholera indeed can also kill within 3 days.
It can kill within hours. Cholera can kill within hours. Of course, COVID has phases. This cholera, the phase is acute. And once it is acute, whatever the patient is going through is fast, rapidly deteriorating. You are draining out your water content of the body. And water is about 70% of the body. So I think the NCDC must come up, must stir up, wide publicity, sensitize the populace, bring out charts, go to the radio. They have already been doing that, but the nooks and crannies of our countries are not well penetrated with radio. They should go there and, bulldoze their way and take over the airwaves, the screen, and tell our people that we have cholera with us. These are the steps you should take to avoid transmitting the disease.
Why do you think that people are not scared of cholera as to COVID?
Well, people are not scared because everybody is down. What are you going to be scared of again? You don't have money. Everybody is waiting for the worst to happen. And I pray we don't get there. So this is the main thing. Poverty. It's a disease of poverty. No doubt about it. Because if you have money with you, you should not be going to buy rotten, food materials. Should buy fresh one, direct from the farmers, and you prepare it, in a hygienic way. So poverty is the underlying factor.
Interesting. Also, let's look at it from this angle as well. Recently we've had situations where public health workers themselves risk their own lives to try to see that they bring in, the best medical attention or best medical care to people who have been affected by ailments, be it COVID or even this cholera that we're facing now. How much of responsibility is there, and do we have the capacity now to deal with this kind of situations? The NSCDC rallied around very well. they had the credits to the course at the time. But right now, it seems to suggest that everyone is just doing anything they can do. But what would you advise? What would be your advice then in this situation for people to be more cautious, to understand the intricacies and the
care centers that are well manned by different cadres of healthcare practitioners? I think this will go a long way. Let's get to the primary healthcare centers. These are the centers that can take care of this disease and can break the chain so that the epidemics can be controlled, rapidly.
Now, we had with COVID, I'm sorry, I'm just making this comparison because I'm just trying to understand it better. With COVID, we were able to have shots, call it vaccines, if you will. In this one, can we have vaccines for this ones as well?
We have vaccines. We have cholera vaccines. We have vaccines. Of course, that should be part of, preventive measures. No matter the amount of vaccine you take, it takes a time for it to be activated, for it to boost the immunity in the system so that actively your body can mount immunity against the cholera. So before the raise in the health immunity, we must curtail the active diseases that we're having. We must take care of the active diseases. That's where a lot of money, a lot of materials are needed in the health center to get the IV fluid, to get, cannulas, to get antibiotics. And once we get this, then we'll be able to get the disease, the infection under control.
This should also reflect to the capacity of the Ministry of Health, who are complaining right now that there is no money. What then happens? More people will die?
Pardon?
This has a direct bearing with the Ministry of Health. And the Ministry of Health is complaining right now that they don't have any money. As a matter of fact, not just the Ministry of Health, just about every other ministry is complaining they don't have money under this administration. What then happens? Will more people die?
I think the government should look for money. No matter, at least they've been borrowing money. So part of what they have borrowed can be channeled to provide medicaments. I think we can do that easily. The minister should go to the presidency and beg for more money. A lot has been said about how, money borrowed, misappropriated or diverted to other things. The health of the citizen should be the primary aim of any government. If we fail in taking care of our health, which is a form of security, then we will fail as a nation. We should borrow money and take care of our people.
Okay.
Defecation, wash your hands. So if you prepare your food, of course, boil your food. Boil tomato. Even if they are rotten, boil them very well. And neatly, hygienic environment. That is the main thing. We should ensure that. In those days, the local government come readily to perform these duties. Primary health care. Make sure people are sanctioned. We used to have public health supervisors, wale, in those days. And people fear them because when they come to your compound and the compound is not neat, your toilet is not well located, you are sanctioned. But nothing happens like that again. So punitive measure must be put in place. Sanction people who violate personal hygiene or environmental hygiene. Thank you.
How much of a punitive measure do you think will be effective? Because we are in the rains now, the floods are already setting in. Devastation. If you've been watching on the news, you would see that the level of flooding has increased, and the rainy season hasn't even gotten to to the peak yet. So there are fears that we'll be facing more flooding, and with more flooding and the cholera outbreak, the situation only gets to deteriorate further, Doctor. Can we battle this impending, this coming floods as against the cholera that we're facing?
Gimba, the problems are multiple. So sanctions will help. It may not stop everything, but sanctions, continuous sanction within the environment, continuous surveillance, and making sure that proper things are done properly. Enough of all these political talks. We must deal with the problem decisively. Just like the government did for COVID, they pump out money. So government should pump out money to take care of these disasters. Flooding is coming, so proper planning, multi-sectoral approach has to be, activated so that our own environment
with Lagos being the highest of cases reported of deaths, and many scores of others have been admitted in hospitals, hoping that the Lagos state government will have the capacity to, tackle head-on this epidemic.